Good afternoon. My name is Carmen Foster, and I proudly represent the University of Alabama. My talk today is on assessing the impact of COVID-19 and race-based trauma on the mental health of Black social workers. Daddy changed the world. My daddy changed the world. Gianna Floyd, the daughter of George Floyd, said those words, and she was right. On May 25th, 2020, our world did change, especially for Black people. George Floyd was killed that day when a police officer kneeled on his neck for almost 9 minutes in broad daylight. Now, just 2 days later, the United States would reach its 100,000th COVID-19 related death. And at that time, COVID-19 was disproportionately affecting Black people in cases, hospitalizations, and deaths. Black people were experiencing trauma on multiple fronts, and as a social worker, I was deeply concerned about that trauma. How was this impacting the mental health of social workers, and where were they going to seek support? I surveyed 113 Black social workers to assess their mental health and quality of life throughout the COVID-19 pandemic and the racial injustice of 2020. Now, the overall models of stress, depression, and anxiety were significant. COVID-19 positively correlated with all three models, and race-based trauma positively correlated with both depression and anxiety. These results showed that this was having a negative impact on mental health. And as a part of my study, I also sat down with 20 of those social workers and conducted one-on-one interviews, and 17 of them, 85%, said they were most disappointed by the lack of support from their white social work colleagues. They could not understand how their peers that had the same social work education, the same social work training, and the same commitment to the code of ethics could not show empathy in the face of race-based trauma. So what do these results mean? What are next steps? This means that we need to take a long, hard look in our social work classrooms and our social work agencies to see what specifically we are teaching about the negative impact of race-based trauma on mental health and what supports these institutions have in place. Because Gianna Floyd, 6-year-old Gianna Floyd, was right. Her daddy did change the world. George Floyd's death forced us to acknowledge the reality of race-based trauma so that we could seek support together to help mitigate those negative effects to move us forward towards hope and unity. Thank you.